Oh, yeah, it's pretty.
Put 'em on.
All right. Better.
Hello, hello, hello. Welcome to Natural Parenting Talk with Lauren and Kima here on Fishbowl Radio in the Green Stream and showing simultaneously on Facebook Live on our page, Natural Parenting Talk with Lauren and Kima. Natural Parenting Talk with Lauren and Kima is all about natural parenting, natural living, and a whole lot extra. And of course, we are your hosts, Lauren and Kima. August is National Breastfeeding Month, so today's subject is all about breastfeeding. We are here with IBCLC Amanda Alvarez. Thank you so much for joining us.
Sure.
As always, before we dive into today's topic, we want to spend some time on our weekly segment, which is What's Happening. If you have an opinion about the topic, feel free to call in at 214-431-5032 or add your thoughts in the comments on Facebook Live. So what's happening this week, which is coming up, is Black Breastfeeding Week, which begins on the 25th, which is Saturday. And we are so excited that Black Breastfeeding Week is coming up. It's such an important week to bring awareness to breastfeeding in the Black community because studies have shown that there is definitely
Correlation.
yeah, a correlation with breastfeeding and the infant mortality rate, but there's also a deficit, I guess, or what am I trying to-
Disparity.
disparity. That's the word I'm thinking of. A disparity in the Black community with our breastfeeding rate. So this is just a really great time to bring awareness to breastfeeding and hopefully encourage a lot of mamas who maybe had not thought about breastfeeding to go ahead and breastfeed, which is really, really important.
Uh-huh.
So this Saturday we are having our the party.
No, it's the luncheon and forum.
Oh, the luncheon and forum will be on Saturday, and that'll be a really great event.
From 1 to 3 p.m. Central Time.
Yeah.
And we probably will do some kind Facebook Live at some point
Mhm.
on Saturday as well. So people
Yeah.
who aren't local can participate that way.
And if you are planning on going to the event, we do have a question that we're putting out there for all of the attendees to have an opinion on or an answer to, which is how do we reach the broader Black community? Not just those in the community that were already leaning towards natural parenting, which means they probably would already breastfeed, but how do we reach the broader audience?
Yeah, that'll be
so
a
we're-
great question.
Yeah, so we're hoping to get some great answers to that and some great tools and stuff like that to use to bring about more mamas breastfeeding.
Yeah, absolutely.
Yes, and on Friday we have our breastfeeding party, which is chocolate milk and cookies. And we're so excited about that. We're going to have a lot of lactation cookie vendors and things like that, so you can try a lot of lactation treats. We will also have a photographer on hand to take breastfeeding pictures.
And that's the same photographer from last year. And
Mhm.
hopefully nobody's really shy because it is a man.
Yeah.
But he took pictures last year, which came out really great. I think each mom left with,
Yeah.
well, he sent them to them that night, but I think he took like 10 pictures,
Yeah.
10 photos of each mom. So it was really great. And I
Yeah.
still see those pictures from last year being posted. So
Yeah, just really beautiful pictures and free of charge for you to get those pictures. So just a really
actually, the photographer is being provided by Amanda Alvarez.
yes.
Not
Her
me
no by
specifically.
her organization, the organization that she's a part of, which is the
Tarrant County Breastfeeding Coalition.
Yeah, so we're very grateful for that. So we'll talk
Yes.
about that some too.
Yes. So that's just a few of the things that are going on this weekend. If you're interested and want to go, definitely check out our Facebook page.
Yes.
We've created events on Facebook to check out. So.
Okay, so that's what's happening, and so I want to introduce you to Amanda. And I should have put my glasses on so if you can see me on Facebook, I'm squinting. Oh, okay. Amanda is an IBCLC, as Lauren said. She's a parent of 3, dedicated partner, and reproductive justice volunteer. Her work reflects a background in nonprofit leadership, health, education, community breastfeeding support, and passion for supporting families within the community. Amanda's enthusiasm for breastfeeding began more than 11 years ago with the birth of her first child. It grew as she became a La Leche League leader in 2008. The role, I'm sorry, I've got to
You want
pass
me
it.
to read
Yeah. I should have put my glasses on. I'm sorry.
The role opened her eyes to the need for culturally informed lactation support that could meet parents where they are. So she fostered the development of a truly inclusive and diverse support community near her home in Mobile, Alabama. Amanda went on to become an IBCLC and has worked in hospital and clinical settings. After moving to Texas 3 years ago, Amanda found a perfect fit in her current role, serving families in an outpatient public health clinic. Working with the largely immigrant and refugee population has solidified her commitment to removing cultural and financial barriers to lactation care. Amanda accepted the opportunity to chair the Tarrant County Breastfeeding Coalition, or TCO-BICO, in 2017 and will conclude her 2-year term in December. The coalition serves as a resource to lactation professionals, business, nonprofits, and other stakeholders who work to support, promote, and protect breastfeeding families. TCO-BICO uses volunteerism, networking, and community outreach to link families to existing resources and identify gaps in the lactation support landscape of Tarrant County. Again, welcome, Amanda.
Welcome, and I apologize for that glitch. As my grandmother used to say, keep living. My eyesight has gone, just left me completely.
Yeah. So if you could, we'll just jump right in. So can you tell us what led you to becoming an advocate for breastfeeding?
Wow, that's a big question. I kind of took it for granted as a parent that I would breastfeed. I was pregnant with my first child. I kind of fit the description of the person who generally initiates breastfeeding in the United States. Educated, I'm married. I had resources at my disposal. So it was easy for me to breastfeed. About 6 months after having my first baby, I developed mastitis. But I was in that little gap between insurance policies. My husband had changed jobs, so I didn't have health care. And I really let it go. I let mastitis snowball into just a full-blown abscess. Terrible breastfeeding situation for anybody who's been there. And it really opened my eyes that breastfeeding's not always easy, and it doesn't just work all the time. Sometimes it really is a clinical problem. And so I luckily had some great resources and I got help. I obviously recovered. I went on to have more babies and continue breastfeeding, but that showed me that there was a bigger need than just support and just community in order to succeed at breastfeeding sometimes. And then you fast forward 12 years later and I'm working in public health where I see patients every day who have medical need for breastfeeding support, don't have insurance. And it really, it's become really important to me to make sure that breastfeeding isn't just supported and encouraged, but that it's accessible. I've said it before, but I don't feel like breastfeeding should be this luxury item. You know, it shouldn't only be available to those who can afford it.
Right.
Yeah.
Huh, that's interesting. So how did you link up with the Tarrant County Breastfeeding Coalition?
Well, I was involved in the Breastfeeding Coalition or Task Force back in Alabama, where I was from. They exist all over. It's part of kind of a national network of breastfeeding coalitions that trickles down to states and then communities. And
So
I saw
I'm sorry. So before you go on, then, so every state has a breastfeeding coalition.
Right. So there's the United States Lactation Consultant Association, and then they affiliate with state coalitions who then encourage communities to develop coalitions. Because we need laws and protections at every level. We need service at every level. So I saw what a great resource a community coalition can be because I got to work with those people before I was an IBCLC. I got to see that they network and support one another, that they get educational opportunities because of that network. And so one of the first things I did when I moved to Texas, before I had a job as a lactation consultant, was I connected with the group in Dallas and in Fort Worth because I live right between the two. And I knew that no matter where I ended up working, I would need that support system to be good at what I do.
And so you found the Tarrant County.
Yes.
And so did you remain active with both?
No, I've occasionally attended a few in Dallas, but once I found work in Tarrant County, this is really where most of my time is spent, so it's where I focus most of my attention. But the Dallas Area Breastfeeding Alliance is the sister group, the similar group in Dallas. They host a great event every year. I definitely stay in touch with them, but I don't regularly attend their meetings.
Okay. So you've only been here 3 years. So what path led you to chairing the Tarrant County Breastfeeding Coalition?
I think the term is voluntold. So that's it. I attended meetings for about a year, and I got involved. I volunteered for committees. I showed up and I worked, and I think that is something that always catches the attention of other volunteers, is the people who are there with them, because usually it's a pretty small group of people who really are there doing the work. And so from that group, we had an outgoing chair, but nobody really lined up to take over, and just a lot of transition. We had an interim chair who happens to be my supervisor, and I was asked to chair the coalition. And so with her blessing, I went on, and I've had a great 2 years.
Okay. So tell us, what does the Tarrant County Breastfeeding Coalition, what kinds of things do they do?
We do quite a few things. We meet about 6 times a year. It's during the day. We try to do it centrally. Usually it's at Tarrant County Public Health in downtown Fort Worth. It's a very casual and open meeting. So we encourage professionals, but also parents to come. There's always a baby or two at our meetings. That's completely welcome. I think that's intimidating to some people. They think it's the kind of a serious official board meeting, but that's just not who we are. Right. So nice casual meeting every other month where we talk about what's going on in the community and what's going on kind of at all the hospitals that offer lactation support, but also the private practice lactation consultants. We always have doulas and other birth workers at the events, chiropractors, everybody who's got a hand in it.
Okay.
So our meetings last about an hour every other month, but outside those meetings is where our work really takes place. So our biggest event of the year is our Family Expo and Big Latch On.
Which you just had.
Yeah, you just had a Big
did
Latch
too.
On too. I love that event, and I can talk. We probably will get back to that.
We will definitely get to that.
Because I love the concept of the Big Latch On. I was excited to see that was one of the projects of the coalition when I got here. We have quite a big one. It's in some years been the biggest one in Texas.
Oh, wow.
So I haven't seen all the official numbers from other events this year. But it's a great family expo where we really highlight the businesses that support breastfeeding, and of course we promote nursing in public, which is a really important cause to me. We also support the work of the African American Breastfeeding Task Force. They do different events throughout the year, mainly this year, supporting your events there at Crunchy Boutique for Black Breastfeeding Week.
Which we appreciate. Thank you.
Thank you. You also see us at other similar events. We work with the Infant Health Network at their event, Birth Texas at their event, really to make sure that we highlight what resources are available in Tarrant County, but also to figure out where we're not meeting people's needs so that we can do a better job.
Okay. So what are some of the resources in Tarrant County for breastfeeding?
Let's think. Back up. Most hospitals offer lactation services, right? And so most people who give birth in the hospital see a lactation consultant at least once while they're there.
Okay.
That's really important, especially if you've never done this before, right? So to have somebody come in and just kind of help with position and latch, help you understand who your baby's going to be for the first couple of days and then for the first couple of weeks. Unfortunately, that's where most lactation care stops in the community. There are private practice IBCLCs who do a wonderful job. Those are people who are, does everybody know what IBCLCs are? Have we talked about that?
We have not, so go ahead.
Okay, I'll interrupt myself with that.
Yeah.
So an international board certified lactation consultant is a professional who has studied and completed clinical hours and tested for this credential. Usually it's a several-year process to become an IBCLC. And we handle clinical lactation problems, really. We do a lot of education. We do a lot of just reinforcing normal newborn behavior. But what we're trained to do is solve clinical breastfeeding problems.
Such as?
Tongue and lip ties. We don't diagnose those, but we definitely evaluate for those and inform providers, provide follow-up. Conditions like mastitis and thrush, poor weight gain in infants, infants who are truly struggling to thrive.
Right.
So we do that work. That work is hard to find outside the hospital in Tarrant County. Like I said, there are some private practice services, and those are IBCLCs who you can pay to come to your house. They observe feedings, they evaluate for those problems, and then they can confer with your healthcare provider on how to treat those problems if it requires a prescription or a procedure. That's not available to everybody, either because of the zip code they live in or the distance from the lactation consultant or the cost or the language, right? So we know that that's a big hole in the system.
Right.
WIC provides some breastfeeding support. I think for a long time WIC got a bad rap in the breastfeeding world. I think, a lot of people are familiar with that because they do distribute formula.
Right.
WIC in Tarrant County does an excellent job of also distributing breastfeeding education.
Okay.
So they have a lot of training for their peer counselors, and they do have an IBCLC on staff. That can help.
You mentioned the lactation support in the hospital. So I'm just curious, how does that work? In most cases, does the new mom receive formula and lactation support, or how does that work?
Yeah, it's changing, and it really depends a lot on the hospital where you deliver, and what commitment they've made to breastfeeding, what their policies are. 10 years ago, yes, every baby when they were wheeled to you from the nursery was in a little cart, swaddled in a blanket, and there were diapers and wipes and formula on the cart, probably a pacifier or two. We know that a lot of those things can get in the way of optimal breastfeeding, even for families who plan to breast and formula feed. It's a lactation consultant's goal to help each family meet their own goals with breastfeeding. So that may or may not be exclusive breastfeeding for every baby. But we know that when formula and pacifiers are given without some education and without some involvement from a lactation consultant, they can get in the way of breastfeeding. Most hospitals today have policies that don't automatically distribute those things to babies.
So there are hospitals that are more breastfeeding friendly than others.
Yes. Yeah, there's a designation called Baby Friendly Hospital Initiative, and it's something that's a goal of some facilities and not a goal of others.
Okay.
It has some really specific guidelines that hospitals have to meet. The thing that most patients notice is that they don't get formula on the cart, right? And if they do request formula, it is available. It's, I think it's kind of a misconception by some formula feeding advocates that we're, anti-formula, or we're trying to keep that out of parents' hands. But really, that formula is still available. It comes with education from a nurse or an evaluation from a lactation consultant to be sure that it's medically the appropriate thing to intervene with at that time. Right. But it is still available, and it's still a viable option for a lot of parents.
So, and I'm just curious, going back to the baby-friendly policies or what have you. So is there a list or something that moms can or is it just something that they can Google to find out what hospitals are baby-friendly?
I think all moms know how to Google,
Yeah, right.
right? So if you have been on your hospital's website and they are baby-friendly, you will know it, because hospitals who achieve that certification have worked for years and countless hours to achieve it. They're extremely proud of it. And so on their mother-baby literature, on everything you see, they will be proud to tell you that they're a baby-friendly hospital. There is also a list on the Baby Friendly Hospital Initiative website of baby-friendly hospitals. Texas also has a program called the Texas 10-Step, and that just means that you've met 10 criteria that do count towards baby-friendly, but maybe you're not baby-friendly yet.
Okay.
Yeah.
So what other things aside from breastfeeding go into being baby-friendly?
So breastfeeding is a big part of it, and a lot of the pieces that may not seem obviously connected to breastfeeding are. So baby-friendly hospitals tend to not have separate newborn nurseries where babies are kept around the clock. Again, if you go back several years, babies were generally kept in nurseries, brought to parents to breastfeed maybe every 2 or 3 hours. Newborn babies don't breastfeed every 2 to 3 hours when they're with their mothers.
Right.
So most hospitals are moving to keeping babies in the room. We call it rooming in. And that's not really done to put more pressure on mom to care for her baby unassisted. I think sometimes that's the perception is, gosh, I just need a break, and where's the nursery? We still have that. But what it does is it keeps moms and babies together so that while they still have the support of nursing staff and lactation consultants, they can learn their baby's feeding cues. They can learn how to wake their baby up if they're really a sleepy baby. And they can do those things when they're together with their baby so much better than they could when the baby was down the hall.
Okay, so I'm curious then, so for the baby-friendly hospitals and they're setting it up so the mom does have an opportunity to learn their baby and that kind of thing, is somebody also advising the mom about those things, like look for this cue or that kind, or is somebody walking hand in hand with the mom to do these things?
Yes, so baby-friendly hospitals not only have lactation consultants, but their nursing staff has completed at least 20 hours of breastfeeding-specific training. So I think a lot of people are surprised to know that breastfeeding is a tiny part of what nursing education is for most nurses. You know, the typical nursing school program is very, very small in what
Right.
it teaches about breastfeeding.
Mm-hmm.
So baby-friendly hospitals raise the bar and really require their nurses to have a lot more education, not only on how babies breastfeed and how to help them, but how to teach parents about breastfeeding.
Okay. Very interesting.
Mm-hmm.
Yeah.
Now, I know you mentioned that there are certain hospitals. We get a lot of moms that come in and they'll tell us where they gave birth or where they're going to give birth. And it seems like one name comes up all the time. And I'm definitely not trying to plug a hospital, but I'm just curious.
Well, I work for a hospital,
Okay,
so I'm
so-
interested. Tell
Okay.
me.
But it seems like
Everybody goes to Harris downtown.
Yeah.
Yeah.
Or Harris Southwest.
Yeah.
Right.
Well, mostly downtown Fort Worth.
Okay.
Yeah. Yeah. Harris Hospital.
So they're definitely, obviously, a baby friendly.
Is that what the patients are telling you?
Yes.
Oh,
Yes.
fantastic.
Uh-huh.
Yeah. Yeah, it's funny. It just depends on the parents you come in contact with,
Mm-hmm.
right? I work in an outpatient clinic that's affiliated with a hospital, so the
Okay.
majority of my babies are delivered in my hospital,
Mm-hmm.
right? We're not baby friendly, but we have met the Texas 10-step certification, and we're taking some of the steps that, should we decide to pursue baby friendly, we would qualify,
Mm-hmm.
and we're really proud of that work.
Yeah, that's really important. Now going back to the big latch on, because we talked about it just
Yeah.
a little bit. So how did your big latch on go?
I think it went great.
Good.
I was there this year. I actually missed it last year. I was at a training that the Breastfeeding Coalition sent me to in D.C., but it happened to be the same
Okay,
day
I thought you
as
missed
the
it. I
Big
thought you
Latch
missed
On.
it this year because you posted something that made me think that you weren't able to go.
I was
but
there
anyway,
this year.
Okay.
I was there, and I was really excited. We had just over 300 participants
Oh, wow.
there that day. Now, we had 111 latches,
That's
I believe.
great.
Yeah,
That's
it was-
amazing. Yeah.
It was definitely good. We've done bigger in terms of latches, but the feedback I heard from parents and from the vendors at our expo that we did was really that the experience overall was the best one they've had.
good.
We do it at the Fort Worth Botanic Gardens,
is
so it's
beautiful.
beautiful. The
Beautiful
pictures
setting.
are gorgeous,
I
right?
bet.
And it was just a really comfortable, efficient, well-run event.
So what kind of vendors did you have there?
We had lots and lots of family vendors, right? So we had several chiropractors and photographers there, a couple of lactation cookie companies and bakeries. We had several jewelry companies, a few of the I'm blanking on the word for it, but the products that moms will sell from home, like Scentsy and
Right.
yeah, Norwex, those type of products, some good representation there. But really, it was a nice variety of products. Some things for sale that day, and some people just sharing about their businesses.
Right. We were actually hoping we would have finished early enough to make it out there. We really kept thinking we could probably do both, but
You were some ambitious
Yeah, we
women.
were.
You hosted your own that morning, and then you're gonna just zip over now.
we really wanted to, but
Yeah.
we've heard that obviously that was really really good. So that's really great.
Yeah.
And over 100. Now, what's interesting about the Big Latch On this year is I was part of the Big Latch On host Facebook page,
Okay.
which I don't know if you were or not.
I
but-
was not, but only because we have an amazing event coordinator
Okay.
who really took that project and ran with it.
So, hosts all around the world were commenting and reporting on the Facebook page, and what everybody said over and over and over again. I mean, just the theme throughout most posts was the numbers were way down this year, and
Yeah.
people were really disappointed that the same number of people didn't participate this year as they had in prior years. So it's good to hear that you had so many to show
We
up
had
at-
so many, but the exact same thing.
Okay,
You
so
know,
it was down.
we've had more than 200 in the
Oh,
past with
wow.
latches. So, was there any feedback on what was going on, or?
No.
No.
Nobody knew what was just
Yeah.
everybody was just kind of disappointed and sad that
Oh.
the numbers were down. We had a good turnout, but our numbers were down too. We didn't pull out the actual numbers from last year, but we had 17 to latch. We had
Yeah.
probably about, I think it was like 35, 40 people present,
Yeah.
but 17 to latch. And I know we had more than that last year.
Mm-hmm.
It was still good. We still enjoyed it. And even if there was one,
Right.
we like to say we're a resource for the community.
Yeah.
We're definitely breastfeeding advocates. So if we
Yes.
can get somebody, breastfeeding, that's a good thing.
Yeah.
So,
It's still a fun event.
Yeah.
yeah, it was really fun.
Mm-hmm.
So, now you mentioned working with what's the black part of it?
That's okay. It's the
African
African
American.
American Breastfeeding Task Force.
African American Breastfeeding Task Force.
Yes.
How did that come about to be part of Tico Bico? Was it already in place?
It
before
was
you
in
started?
place when I came, but
Okay.
I think it's clear, and you've talked about it some, that disparity within the community and the just dire need to provide better education and services for those of us in the birth community so that we can reach more patients. So I know it was born out of need and passion. It's definitely some of our most passionate volunteers and our longest running volunteers are part of that group.
Yeah, it's definitely needed, which is why we have Black Breastfeeding Week, which is coming up. And again, I can't say enough how much we appreciate your support. And it is important to have support from the entire breastfeeding community, and not just,
Absolutely.
like I said, that's why our question for Saturday is going to be, how do we reach the broader community? Not because we're in the natural parenting world, we're always talking to people who are already inclined to breastfeed, but how do you reach people who aren't? A good example of that, a very dear friend of mine, her daughter and her good friend of hers, they just moved here from California, and her daughter's friend just found out she's pregnant, scared to death, but she's young, unmarried, but she's pregnant. And so when I heard that, I said, oh my gosh, I got to snatch her up. I just really want to just introduce her to breastfeeding and cloth diapering and baby wearing. And we talk about all the time that it's not just breastfeeding, that we're advocates for the total natural parenting package. So I'm really looking forward to that. But I thought about her and I thought, those are the people that need to be reached. People who hadn't necessarily thought about breastfeeding, or, as Lauren says all the time, you have to think about and know that you're going to breastfeed from the time you find out you're pregnant. You need to start psyching your mind up for it and researching,
getting educated,
and all that. So it's really important. So how does the Tarrant County Breastfeeding Coalition, how do you do that, or do you? And I'm not just speaking of in the Black community. I mean, period. I know that regardless of race, breastfeeding is important.
Absolutely. I think normalizing breastfeeding through events like the Big Latch On is one of the best ways we can do that. You mentioned kind of all the places in the birth community that you touch with breastfeeding and cloth diapering, baby wearing. And I'm right there with you, right? That was the mothering world that I came up in when my babies were babies. And it's one of the few things I get kind of evangelical about, like you see someone pregnant and you want to bring them in.
Yes.
But that's not for everybody, right? And it can overwhelm some folks. And I think, well, I'm not that. Like, I'm not going to exclusively breastfeed and wear my baby and cloth diaper them and do all those things. I just want to breastfeed a little bit.
Right.
And so I think we need to really promote or events like the Big Latch On and other opportunities to see just normal people feeding their babies.
Exactly.
It's not always the best to kind of put somebody in, like, this is the portrait of a breastfeeding person. Right. We need to broaden what that looks like, and that needs to include just a better diversity of races, of course.
Definitely.
But also just lifestyles and choices that we make.
Right. And even breastfeeding beyond the infant stage.
Absolutely.
We said this so many times, but Lauren definitely gets a side eye now. August is 21
for sure.
months, and she's still breastfeeding, and there's no sign of an end. There's no, he's going to breastfeed from now on.
Yeah.
Until college.
Yeah, my oldest is 11, and we had to finally have that talk. Kidding, but no, it's definitely it's not the norm in the United States. And even when it is common, like even when you find people who breastfeed that long, they're not telling anybody. They're doing it at home or in the car or in a dressing room. They're not even telling their pediatrician. So I work in a pediatric practice, and so they may tell me that they still breastfeed their 3-year-old once a night to put them to bed. But if I look in their chart and they've been interviewed on, nutrition, how they're feeding their baby, they're not mentioning that they latch that baby on or that child on anymore because of the side eye, because of the look. And that's a
really
shame.
sad.
Yeah, it is.
Yeah.
If you didn't, I wonder, so if you weren't going to a holistic doctor.
I'm sure because, there's mom groups all over. And you hear, people are starting to get discouraged once their child is, especially once they're over a year old, saying, you're going to cause dental problems for them. And, the sugar in the breast milk is going to cause them to have cavities.
And then somebody recently said that it causes emotional problems if you breastfeed beyond the attachment problems or something like that. That some psychiatrists just went in saying, no, you shouldn't breastfeed beyond a certain point because it causes all these psychological problems and dependency and all this. So,
wow.
Yeah. It's so funny because we are definitely passionate, pro breastfeeding advocates, obviously, but the people on the other side, I guess, are just as passionate in wanting to say,
enough already.
Yeah.
Right. Well, what we need to be is passionate about just supporting parents in knowing what's best for themselves and for their child.
Right.
Yeah.
And really leave it to them.
Right. Right.
Yeah. So are there any disparities with other races? We hear a lot about the disparities with the African American community, but that's really all that we hear. Is there any other disparities, perhaps just in Tarrant County or nationwide that you know of?
Yeah, there's definitely kind of cultural generalizations. I would be really hesitant to just start listing stereotypes, but there's definitely assumptions made, and unfortunately, they're made by healthcare providers a lot of the time. And I include myself in that group. But it's easy to fall into the trap of looking at a patient and saying, well, she's Black and probably not going to breastfeed. Or she's Hispanic and she's probably going to breast and formula feed. And those things hurt us, and they hurt our patients because we don't really give them the support they need to meet their goals effectively.
Now, you said something earlier about your own experience and how it was easy for you because you automatically knew you were going to breastfeed. There wasn't a question or whatever. So kind of tell us about that. I mean, were you raised in a breastfeeding environment or?
I was actually. My mother is, she was 30 when she had me. And in her generation, almost nobody was breastfeeding. She said that she knew one friend and maybe the wife of a coworker who were breastfeeding. And that was it. Like, people just weren't breastfeeding. And she was working full time. And so she really did something unusual in breastfeeding my sister and myself. But the women, her sister who had a baby, my aunt, when I was a small child, breastfed her baby. The women that I saw around us breastfed their children. I grew up in Catholic school. There were lots of babies, and there was plenty of breastfeeding going on in their homes when I was playing with the other siblings.
Right.
So I grew up seeing breastfeeding, and then as I learned about it, just as a health concern, as I prepared for pregnancy and during pregnancy, there was never a question of if I should or if I wanted to.
Isn't that interesting?
Or even if I'd be successful at it.
Yeah.
I really kind of took it for granted. I wouldn't say kind of. I definitely took it for granted that my baby would be born and breastfeed without any complication. Yeah.
We've got a couple comments. Nakia has joined us and said that she said her child was almost 2 when he self-weaned. No psycho issues here. Implicit biases, they exist. And Tequila says, I totally agree with something I said before, so I should have read it a long time ago. But she's giving us clapping hands and everything.
Right.
Nakiba says hello and hashtag breastfeeding. And I
We
thought
got a lot of
we got
waves.
we got lots of waves.
That's
So
good.
people are waving at you. So just wanted to let you know
Thanks,
that people are commenting.
Well, Nakia and Makiba are involved in the African American Breastfeeding Task Force.
Oh,
and
okay,
have been
okay.
in the past, so I'm glad to know they're out there.
Yeah, and doing good work.
Yeah.
So I think it's time for us to take a break. We're going to take a 2-minute break, and we will be back shortly. Remember, during the break, there will be silence due to copyright laws. We can't play music on Facebook during the break, but we will be right back.
Welcome back to Natural Parenting Talk with Lauren and Kima. We are here with Amanda Alvarez, IBCLC and breastfeeding advocate. And of course, we are discussing breastfeeding. And we talked about the Big Latch On, which of course is a global event where moms come together and they breastfeed to raise awareness. But we wanted to talk a little bit about nurse-ins. Now it's been in the news a few times about moms being, ridiculed or told to go in the bathroom or whatever by store managers.
Being told to cover up.
Did
Did you see all the posts? There's been a million posts on social media of moms covering up their heads.
Yeah.
Yeah.
Yeah. And even here in Tarrant County, there have been some restaurants that have told moms, you need to cover up or leave or whatever,
Right.
which has caused a response, which is the nurse-in,
Yeah.
which is a protest, basically,
Yes.
where moms gather together and they go to the place where they've been told not to go to breastfeed, and they breastfeed, in an effort to say, we're here, this is okay, and we're not doing anything wrong. So can you talk about that a little bit?
Yeah. Absolutely.
Have you been a part of any nurse-ins or?
Yes, I
Okay.
have. I think they have their place, right?
Mhm.
I think especially in today's political climate, when you tell a woman that she's not going to get to do something that she knows she can do, we're standing up. You're here.
For
So,
sure.
a lot of women are kind of reclaiming that, and I think that's important.
Yeah.
Most of the time when someone is harassed in public for breastfeeding, like by a store employee or it happened with a bailiff in a courtroom back in my hometown not too long ago. What they're doing is they're speaking from their own personal bias, their own personal concern, and almost never do they actually have a policy to back up what they're doing.
Right.
Most stores and restaurants and definitely cities and public places all have laws and policies in place to protect public breastfeeding.
That's right. That happened in Fort Worth maybe a year or so ago. That somebody was sitting on a park bench or something, and a police officer came by and said, "You've got to cover up."
Exactly.
Yeah.
So I want to start by saying you have the right to breastfeed anywhere that you have the right to legally be.
Everywhere in the country.
Yes, absolutely. So usually it's a person just kind of speaking out of turn because they're uncomfortable, or what's worse is they'll blame it on you making someone else uncomfortable, right? They're worried that you're going to make another person uncomfortable. I think it's important to set those people straight and make sure they know not only do you not get to tell me that, but we're going to make sure that everyone knows that you did this egregious thing, right? Those events do a great thing. I hesitate to always get behind all of them because if all we hear in the news is harassment and protest, then that paints breastfeeding as this act of defiance, right? It definitely, you were speaking to like, how do we reach out to those parents outside the crunchy community?
Right.
Well, it kind of boxes that idea, that profile of a breastfeeding woman now is this, she's a protester.
You're right.
She's defiant.
Yeah.
Some of us love that title, right? Like some of us are a little bit proud that we got to do something so bold, but most people are intimidated by that.
Right.
And if they thought that, oh my gosh, if I'm breastfeeding and every time my baby gets hungry, I'm going to get harassed or have to go sit in my hot car, then they're not going to bother breastfeeding.
Right.
It's
That's
not
true.
worth the hassle. It's not worth the comments.
Yeah.
So they're just not
There has
gonna
to be a
breastfeed.
balance.
Right. So I think events like the Big Latch On, and even just you see campaigns on Facebook like Free the Nipple, or these just posting breastfeeding pictures or Brelfies. You see those. It's a great thing because it just normalizes it in our mind that okay, this is life. This is how it works.
And the interesting thing that you keep saying is that it's really about public breastfeeding.
Yes.
It's not just that you're breastfeeding off, although obviously that's very, very important, but it needs to be public breastfeeding because that's the way that you normalize it. If people start getting used to seeing people breastfeeding, then it won't be a big deal.
Right.
Yeah.
Yeah.
So that's the important part. It's like,
I think in
don't,
most
don't
parts
hide.
of the world, that's kind of how it is,
Yeah.
right? There's babies and they're going to be breasts. And what shocked me, I talked a little bit about how I was kind of primed to breastfeed. Everybody expected that I would, and I expected that I would. But I had expectations going into it, especially in the South, and it's a very conservative community. And very early on, my baby was maybe 2 weeks old, and my dad came into town. He's an especially conservative white man. For those of you who aren't watching on Facebook Live, surprise. Right? So my dad was super conservative, Southern Baptist. We're sitting across from one another with the rest of my family, having brunch in a restaurant, and my newborn baby cries, right? So, honestly, it didn't faze me at that time to already just pick her up and latch her on. I was determined to do it that way, and so that was my plan. But I got her latched on and situated and continued talking with my dad, and he kind of paused, and I was like, here it comes, right? Because he's kind
You knew
of,
he was going to have a response.
right, the person that I would expect to be maybe judgmental or have a comment about, like, covering up. You know, modesty was a big deal growing up with him. He said, you know, I used to see this all the time in church when I was little, and I completely forgot. But you saw women, you know, breastfeeding in the grocery store or at church or wherever they were with their babies, because that's life, and what else are you going to do? But it surprised me because I was expecting more pushback than I got.
You know, what's interesting is how times have changed, because there was a time when breastfeeding was very normal and it was happening all the time.
Yeah.
And if you look back, if you Google it or whatever, there were TV shows, there's cartoons, it was on Rugrats, there was all these things, you know, not that long ago that talked about and showed women breastfeeding all the time. So something happened to change things, where now it's just, it's odd. If you see somebody breastfeeding now, I mean, you do a double take, like, wow, they're breastfeeding.
Right. Yeah, we live in a really polarized time, and I think it's more of that separation of breastfeeding versus formula feeding. And so now you're right, when you see breastfeeding in a TV show or in the news, it's contentious. It's always someone complaining about the hassle or the pain of breastfeeding, or someone being harassed, or someone who's formula feeding really feeling the need to be defensive about that. I don't think that's the reality for most people in our day-to-day lives, but that's absolutely what we're being shown on TV and in the media.
Right.
Yeah, I definitely agree. All you really see, you know, in TV shows and movies and things like that, it's like the negative aspects of it, or somebody being embarrassed because they're leaking, or it's like, you know, which of course some of those things do happen.
Sure.
But you got to show both sides.
Yeah. But, you know, birth is the same way. Y'all, y'all know the birth community, and who has seen a normal birth on a sitcom ever?
Yeah.
You know, it's just not, it's not part of the fun way to tell that story, I guess.
And you're right, it does get very defensive. You know, we post on social media a lot. We use a million hashtags, and usually when I post something about breastfeeding, I use the hashtag breast is best. And I don't do that to belittle a formula fed, you know, baby, family, or whatever. I mean, again, as you said earlier, it's everybody's decision. You do what's best for you. But I don't think that you can argue that breast milk is best for the baby. I don't think that should be an argument. I don't think, and I don't ever say it to cause anything. I mean, it's like, if you can, maybe we should add that breast is best if you can. I don't know.
Or if you want to.
Or if you want to, or whatever. But it, you know, but anyway, that just speaks to your point about it's just so contentious, and everybody's so defensive.
Yeah,
and
it's almost become one of those things, like, you don't talk about politics, you don't talk about religion, you don't talk about breastfeeding.
Yeah.
It's like
Which is really a shame, because that means we've kind of lost the skills that we need to talk about politics and breastfeeding and religion in a civil and you know, conversational way. This mommy war thing, I think, is I don't think it's real. I just really have a hard time seeing it in my daily life face to face with parents that I see.
On social media, you see it, on TVs, movies,
Oh,
commercials.
it's very
you see
real
it,
outside.
But when you actually talk with another mom who, you know, like
is
for
doing
me,
the opposite.
yeah, who like for me is maybe using disposable diapers, formula feeding, you know, never use a baby carrier, that kind of thing, we're fine.
Right, exactly.
It's not
an issue. Yeah.
But on social media, for sure, everybody's defensive, because the other question we get is, why Black Breastfeeding Week? You know, it's important for everybody. Why Black? Which is why one of our posts was, these are the reasons why Black Breastfeeding Week. But that was in response to all the negative comments we got last year, where people were saying, why Black breastfeeding? Well, why is it, you know, breastfeeding is important for everybody, and why do you have to separate yourself and all that? So, yeah, it is. It gets to be a bit much to have to argue every point.
I can imagine. I've only done it from my perspective, and it gets to be a bit much, and I don't have to face it nearly as much as you do. But we had the same issue last year with the Tico Bico posts about Black Breastfeeding Week, and had to delete a lot of things and had to moderate a whole lot of comments. But we just really have to keep doing it anyway.
Right, right.
You know, we have to remind people that shining a light on one problem does not divert it from something else.
No.
There's plenty of this to go around.
For sure, for
Yeah.
sure. And we all need to be concerned about what's going on in the Black community. I mean, even outside the community, it's real, it's important, it's urgent. And everybody should, if not concerned, at least be aware.
Yeah.
So when we talk about the Black community and even the Latina community or Latino community, I'm sorry. I know you can't really speak for what.
Please don't ask me to speak for another community.
But
I'm
do you
smart enough
but do
not
you
to
know
that.
what's being done with the coalition to kind of bring some of those moms in to help those communities out?
I think one thing that we know as a profession of lactation consultants is that parents learn best from healthcare providers that they can relate to. And so it's a really important initiative among lactation consultants and in the bigger birth community. I've seen it. I can only speak for lactation consultants, but we are really trying to foster the development of a more diverse professional workforce. It is expensive and time consuming to become an IBCLC. And because of that, it's a pretty select group of people. We all tend to look alike. But we're working on that, right?
Do you know,
Go ahead.
I asked this question a couple days ago. Somebody came in and we had this conversation, and I asked her if she knows how many Black IBCLC. Let me say this: the birth community here in the DFW area is
Small.
very small, and everybody knows everybody. We found that out really quickly.
Yeah.
Everybody knows
It's
everybody.
like a small town.
Yeah, it's hilarious. People will come in and say, "Oh, do you know blah blah blah?" Or, "Yeah, I just went here and I did this with this person." And 9 times out of 10, we know who the person is because they've been in Crunchy Boutique, and somehow or another we've met them. It's amazing how small this community is. So I don't mean to put you on the spot, but I'm figuring you know.
Okay.
How many Black IBCLCs in the DFW area? Just roughly, you can give a range. I'm just curious. And then total
Okay.
altogether, regardless
No,
of race.
that's okay. I know 2 personally in Tarrant County and 2 more who practice in Dallas County. And there are definitely more than that. But that's a very small percentage, especially when you look at the demographic breakdown of Dallas and Tarrant, Dallas County and Tarrant County. It should be more representative. It should kind of reflect the community
Right.
that we serve.
And so when you say that it's important to have a diverse, for there to be diversity among the IBCLCs,
Yes.
it goes back to what we say every single week.
Representation matters.
Yeah. Oh,
Yeah,
of course.
definitely.
And it's not a, I don't think it's a bad thing, and I don't think it's racist or anything like that to say that most people are more comfortable with people that look like them, who've had similar experiences, who somebody on our show before said, somebody who, knows the slang, and,
Yeah.
you can just,
That's okay. That's
Yeah, and-
definitely acknowledged by most of us.
Uh-huh.
I can't speak for everybody. But yes, we learn better and we relate better when we feel like we have a lot in common with the person that we're sitting across from. And some of that can be overcome, right? I see patients every day. In a given day, I might see 6 or 8 families on a nice busy day. Maybe one of them speaks English and none of them are white, right? I can still give great care.
Right,
I can
right,
still
of
relate
course,
to my
of course.
patients. I happen to have had children and breastfed, so I can share that common experience. There's lots that we have in common, but it's not the same. And I'd be crazy to think that it was. So I, as a white IBCLC, I think I can just keep that in mind, that I'm yet another white lady in scrubs sitting across from them telling somebody what they ought to do or what they ought to do with their baby. And so being sensitive to that's really important. But outside of what I do clinically, I can support programs like the African American Breastfeeding Task Force and the clinical IBCLC education program at my hospital that really helps people achieve the stepping stones necessary to become an IBCLC without such a huge financial investment.
okay.
We're going to take a short break, and we will
About 7 minutes.
Yeah, about 7-minute break. And we will be back right after that. And just a reminder, you should hear silence on Facebook Live due to copyright reasons. So we will be back in just a few minutes. momentarily. Welcome back to Natural Parenting Talk with Lauren and Kima. We are here with Amanda Alvarez. I'm sorry. Excuse me. Something tripped in my throat. IBCLC and breastfeeding advocate.
Now, before we go on to our next question, I wanted to read a couple comments. Jarrell Cox has joined us. Hi, Jarrell.
Hey,
We miss
Jarrell.
you. And Tequila Gregory wants to know if you have any information for upstate New York. She says having more Black women in hospitals who are versed in breastfeeding would be huge here.
Absolutely. I cannot speak to the specific work being done in upstate New York, but I definitely would start with their state breastfeeding coalition. That's an easy enough thing to Google. But the state breastfeeding coalition can direct you towards community breastfeeding coalitions close to the city or town that you're in.
Mm-hmm.
Okay, great.
Yeah.
Now, we wanted to go back to what we were talking about before the break.
Black moms breastfeeding. That's what we were talking about. What?
Okay, this is a real moment, a real live moment. You know, if we had something that we could cut this out afterward, I would definitely say cut this out. I forgot what I was going to say.
I think we were asking, well, we already asked what's being done to kind of increase the numbers of Black moms breastfeeding. But
Thank you.
Yeah.
Okay, it came to me. I just celebrated my 55th birthday in May, so I'm gonna blame it on the age. Anyway, we were talking about diversity. We've talked about diversity in breastfeeding moms, but it's also important as you talk about the numbers of Black IBCLCs, at least in the DFW area. So my question is, what, if anything, is a coalition doing to increase those numbers, or is anybody anywhere? Let's start with Texas. In the state of Texas, trying to increase those numbers, because obviously there needs to be improvement in that area.
Yes. So there are several pathways that the IBLCE, which is the credentialing organization for our profession, there's basically, it organizes into pathways to becoming an IBCLC. Because some of us come from a healthcare background. They're people like nurses or occupational therapists, dietitians, and so they have a strong health sciences background. Then there are folks who have no experience in health education or in health care, and so they have kind of a different pathway, a different way to meet the requirements. Whatever that pathway is generally expensive and time consuming. And so different states are addressing that different ways. I've seen some community colleges develop curriculums that include all of the education that is required. You know, IBCLC is a really unique credential in that it includes some health sciences, but also a lot of counseling and sociology. So we're really expected to have this broad knowledge base that until recently didn't exist within an academic program. So you want to be an IBCLC and you're having to take classes here and here and here and enroll in multiple programs.
So how old is it?
The credential itself is in the 20 years
Oh,
or
wow.
so.
So it is young.
I should know the exact.
No, that's good enough. That's
It's
young.
a relatively young profession. So we're finding some great new ways to meet the requirements to become an IBCLC. Specifically, one of the things that can be really expensive is the clinical experience. If you're lucky enough or you've worked in a field that already works with maternal and child health, like maybe you're a pediatric nurse, it's easy to meet the requirement for clinical hours of lactation care. If you don't, say me, I had a background in public relations, right? So I had never done
took
this
a big jump.
professionally. So I had to find those hours. In order for me to do that, I had to pay tuition at a college that I was attending for an internship and then go work for free. When during that time I had to pay for childcare, right? I was fortunate enough to be able to make that work, but that eliminates a huge number of people, and not specifically Black people, of course, but I think by eliminating some of those barriers, we make it more accessible. So one of our local hospitals, JPS, has a program where IBCLC candidates who've fulfilled their education but now have to meet that clinical requirement, they can serve those hours under the guidance of an IBCLC at the hospital for free.
Oh, okay.
They're unpaid hours. That's the requirement there, but they're not having to pay for that privilege,
Right,
which is a
right.
huge step.
Right.
And,
So-
and what does JPS stand for?
I'm sorry, it's John Peter Smith Hospital.
Okay.
It's the public hospital here in Tarrant County.
Okay.
So has that attracted many people?
Yes, we've had several students come through and graduate from the program and go on to become IBCLCs. 2 of them have gotten jobs at JPS as lactation consultants. It's not a guarantee from going through the student program, but it is a great way to really try out the profession and see the ins and outs of inpatient and outpatient lactation care.
Okay.
So as far as the coalition is concerned, do you track numbers? Is there, do you track success rates with moms that you work with?
Well, the coalition doesn't provide any lactation care services. We're more of just an association of professionals and other
Okay.
stakeholders who promote breastfeeding. So each hospital keeps breastfeeding statistics. The state keeps breastfeeding statistics. So all of those things are trackable, but not through the coalition.
So do you find that the numbers state that the numbers are going up or down?
Breastfeeding initiation rates are higher than they've been since we started counting them
Okay.
decades ago. More people start off breastfeeding than used to,
Okay.
right? So that's a really good thing.
Yeah.
That means we're doing a great job prenatally teaching the importance of breastfeeding, and we're doing a pretty good job in the hospital helping people initiate breastfeeding.
And you keep emphasizing initiate, so I'm assuming that means
There's
that
more, yeah.
yeah, that they're easily discouraged or they're dropping out or
Yes. So we keep statistics on who starts off breastfeeding, who intended to start off breastfeeding, who was successful at exclusively breastfeeding, if that was their goal, by the time they leave the hospital, and then at different increments throughout the child's infancy, so that we know how long did they get to continue breastfeeding. And then the statistics kind of split with if they initiated formula and when. So we see that a lot of people start off breastfeeding. Very few people are successful at continuing breastfeeding exclusively for as long as they want to. Yeah. And I can talk for hours about that. So.
well, it's I think it's fascinating though.
Yeah, it is. So as far as Tico Bico is concerned, what's next? Like your next big event or anything coming up?
So we just wrapped up the Family Expo and Big Latch On, and we're moving right into the Crunchy Boutique Black Breastfeeding Week events. Our big project that started this year and will continue for at least another year is a community needs assessment.
Okay.
That was a project.
Oh, you mentioned that a while ago.
Yeah, it's kind of my project, so I'm really excited about it. But it came out of the conference that I attended last year with the United States Lactation Consultant Association, and it's something that's been done other places, but basically it's an attempt to get a snapshot of where breastfeeding resources and lactation resources are in the community, first so that we can get that to parents. We have a resource sheet on our page or on our website.
Right.
You know, you can click on it and it'll list a bunch of lactation consultants. We're in the process of updating that because it changes from time to time. It needs to be updated. It's great to give parents a list of resources, right?
Right.
But as professionals, what we need is a snapshot of where there are not resources, so that if a private practice lactation consultant wants to start a business, where can she go that that's not being served?
Yeah.
And if there's a community, whether it's cultural or location or language, that's not being served, they're not getting breastfeeding help, where can we do a better job? So
So-
I'm excited about that project.
So how is the needs assessment? How is that going to be conducted? And before you do that, your mother-in-law says she's very proud. She couldn't be prouder of you.
Thanks. All right. So the community needs assessment is a work in progress. And we started out with a survey. And I'm a little on the frugal side. So I developed a 10-question survey through SurveyMonkey. Because
That's
what
fine.
you get
It
for
works.
free, right? And I really tried to squeeze a lot into that survey. And it was a way to identify who are you and how do you reach parents, and are you in a hospital or in the community, and are there certain zip codes or languages or special groups that you reach. We wanted it to include lactation consultants, but also other resources like your shop, like chiropractors, like dentists and ENTs who clip tongues, everybody who touches breastfeeding families. That's a lot to ask of a 10-question survey. So we got some good data out of it, but it's not quite meaty enough for me. So I had to swallow that and say, okay, I tried. That was not the best approach. And now I'm really just going backwards and just having conversations and talking to people, phone and email, to say, who are you and what do you do? Because we know that everything that we do doesn't have a checkbox on a survey.
Right.
So we want to capture not only, what hospitals have IBCLCs 24 hours, but also what churches have support groups and what neighborhood community centers have a play group where there's somebody who talks about breastfeeding. We really want to get everybody.
And how are you defining the community? You said you're doing this.
Tarrant County.
Okay, so Tarrant County.
Yeah,
Okay.
and we always hear from somebody like right outside of Tarrant County, and that's okay too.
Right.
We're not trying to exclude anybody. We're not going to limit the results to members. Tarrant County Breastfeeding Coalition has a paid membership that you can pay, and you become a supporter of the coalition. That's great as a business. It's great as an individual, but that's not a requirement to be part of this community.
So once you get the information from the assessment, what do you plan to do with it? I mean, what's the next step?
The next step would be to really make an interactive tool on our website. Ideally, that's a calendar that by day you can look at, okay, I need a support meeting. I just need to be around some other people who've done this and get me, right? Or I need an IBCLC who can see me today, because breastfeeding problems can't wait. Like, we can't say, I'll see you in 2 weeks.
Right.
That doesn't work.
It's interesting in our where we are at Crunchy Boutique, and this is another repeat story, so I'm sorry if you guys have heard this already, but we had a mom come in a couple months ago who was she had a brand new baby, very discouraged about breastfeeding, and she was about to quit. She was very discouraged, and so we said, try to encourage her as much as we could, and we're not birth workers. We say that all the time. We're not lactation consultants or counselors or anything. So the only thing that we can do, which we love to do, is rally the troops.
Yeah.
So we put a message on Facebook, asking who in the community could come at a certain time just to meet with this mom and encourage her. And the response was really great.
Yeah.
It really was. And it just, as just being the mediator, we were just the facilitators, obviously. But it gave me such a good feeling, personally, that, maybe that little bit was enough to keep the mom breastfeeding. And when you talk about a need in the community, I think that's one of them. It's just that support. It's knowing that you have a support system, because you may not have it in your family. I mean, even as Lauren has said, at this age in breastfeeding August, people look at her like, okay, enough already. But, her husband is supporting her still. I'm supporting her still. But, if there's somebody out there that doesn't have that,
Right.
that's definitely a need, that you need somebody to just say, you can do it. Keep going. You can do it.
Yeah.
So, and I'm assuming that somewhere in the breastfeeding coalition, the Tarrant County Breastfeeding Coalition, that's part of it too.
Absolutely. Yes, there are community support groups for breastfeeding all over Tarrant County. We have a really active La Leche League group, and La Leche League is great. Meetings are different from one group to another, and not every meeting is the best fit for every parent, but it's great that we have so many to choose from, because some do focus on nursing toddlers, some are during the day, and some are at night, which are usually more convenient for working parents. In Dallas, I know of a couple that are led by Spanish-speaking leaders, which makes a really big difference. So community breastfeeding support is where I come from. That's where I got here. And I think it's really important to have a variety of community support groups so that people can find the one that's right for them.
Definitely. And I know in this age of technology and social media, everybody is, joining groups. So there's breastfeeding groups and cloth diapering groups and baby wearing groups, and all that is all well and good. That there's a place for that. And I think it's important. And I'm a member of a million groups. It's ridiculous. I can't even keep up. And it's helpful, but there's something about being in person and actually being able to talk to somebody. First of all, because on social media, people become whoever they want to be, and people tend to get real bold when they get behind a keyboard. People and the bullying and all that kind of thing happens. So it just changes. The dynamic is totally different face to face, and that's just so important to be able to find somebody that can literally hold your hand.
Yeah, somebody to just sit beside you.
Yeah, I was gonna say, especially with breastfeeding, so you can, say, I'm gonna feed my baby. Look while I'm feeding, and tell me if this is okay, and all of that. So
Yeah, I get text questions all the time from like friends of friends of friends, or somebody I helped 10 years ago. And I always say, gosh, is there somebody in your city? Like, let me help you find somebody where you are who can really sit with you. There's so much of this that's lost over Facebook or a text message.
For sure.
Those tools are great, but yeah, I think there's a lot to be said for sitting with somebody.
And Catherine Powell-Hanks says, this is an awesome project you are doing. What a huge help to your community.
All right, so Catherine Hanks is my mentor. She led me to become an IBCLC.
Oh, okay.
And probably one of the most influential professionals in my life. So
Oh,
hey.
great. That's wonderful.
Yeah.
Yeah, it really is a wonderful thing. You know, it really is, and it takes a special person. I just think nurses are special people. Anybody in the medical profession, to me, because that's just something I just couldn't do it. That would be difficult for me, even being a lactation consultant or whatever. So it does feel a huge need. It's great. I just think it's wonderful.
So, for moms that are listening or who will watch this after we're not live anymore and they're interested in becoming a part of a coalition, maybe right here in Tarrant County or across the United States, how do you become involved in a coalition?
For our coalition, the best thing you can do is find us on Facebook, or our website is kind of in need of a little makeover. It's still there, great information, and if you click email us through our website, you'll get us. I think Facebook's easier for most people these days, but we're TarrantBFCoalition.org. But like I said before, every state has a coalition, and it has a directory of local coalitions. If there's a lactation consultant at your hospital, or a La Leche League leader in your community, or a baby cafe in your community, those folks all know who's involved in breastfeeding in the community.
And you mentioned paying. Let's talk about that some, because I know that there are free resources, and then there are times where you have to pay someone to help you. So can you kind of describe the difference and how?
Yeah, absolutely. So in the hospital, you'll have an IBCLC. That's just included in your care while you're there. Most hospitals also have a breastfeeding class. Some are free, and some they want a small fee. Some are only if you are planning to deliver there, and some are open to anybody. In Tarrant County, there's also some free breastfeeding classes through the Natural Way Birthing Project. JPS Hospital has some breastfeeding classes going on right now. But it's really the after hospital or birth center discharge where you're kind of left to figure out who can help me, right? Because now my baby's awake, right? They sleep those first couple of days, but you go home and that baby wakes up. So in Tarrant County, you have lots of options, but you have to know where to start, right? So private practice lactation consultants are pretty easy to find on the internet. And you could also find the links to some on the Breastfeeding Coalition website. WIC has some breastfeeding resources. I'm really proud of where I work. I'm not here to represent JPS, but I'm really proud of the program that we have. It's unlike anything else in the country. There's only a few places in the country doing what we do. And what we do is we provide IBCLC care in community health clinics spread out throughout Tarrant County. So I cover a couple. I'm in Arlington and Bedford, and I have 5 coworkers who cover multiple other clinics. We see thousands of patients a year between the 6 of us. We are incredibly busy.
That's great.
I was late today for a patient, and I will run out the door in a hurry to see one when we're done. But what I love about our program is that it's free. There's no copay. There's no charge. We're not worried about where you delivered or what language you speak. We just want you to get to us.
And how do people get to you?
Patients can schedule through the JPS main scheduling number. Do you want me to give that?
You can.
On air? Okay. It's 817-702-1100. That number is just the main call center for JPS. But they can let you know which clinics have lactation care and get you on an IBCLC schedule, usually the same day or the next day that you call.
Now, you said that your program is unlike others. So other states don't necessarily have...
not every hospital can offer that. There's just not a lot of IBCLCs. And most hospitals employ just enough to see and keep up with the births that they see. So you kind of determine how many IBCLCs your hospital has based on how many births you have. So usually we're pretty busy when we work in the hospital. I know the ones at JPS are. They're just seeing patient after patient. So once a patient's discharged, if they're having trouble, they can call. And some hospitals have kind of some time set aside in the afternoons when they see their own patients,
Right.
you know, after discharge. But most just can't keep up with that need, especially throughout for the duration of breastfeeding, because breastfeeding problems don't always happen with a newborn.
Right, right. Now, Rachel Alba Davis says, just went to my first big latch on, and it was great to see all the resources. So, yay.
Fantastic.
Here I go again. That's because when you're talking, my mind is racing, and I'm thinking of all these questions that I want to ask. You mentioned La Leche League. Let's talk about them a little bit.
Yeah.
I know you're not a representative of them, although
No,
you said
that's
you were a
I was
member.
the La Leche League leader for a long,
Okay.
long time. I didn't maintain that once I started working full time. I didn't feel like I could commit enough service.
Okay,
in
but
that
can
time.
you describe what they offer and
Yeah.
and how you can get in touch with them as well?
Yeah, sure. La Leche League is an international organization, and they have people within the community, generally women, who have experienced breastfeeding. They started in the 1960s as a group of women at a church who saw that there was a need to support one another because there just weren't a lot of breastfeeding women. And so they founded this group that spread like wildfire. So there are lots and lots of groups all over the world, tons in the United States, and they're all very different from one another. So traditionally, they were led by women who had breastfed.
Where did it start? Did you say? Do you know?
In the early 1960s.
No, where?
Where? In Illinois.
Oh, okay.
And so most La Leche League groups for a long time were led by married women who had breastfed. And they were attended by other married women who breastfed, who looked a lot like them.
Right.
And that's a beautiful thing, you know, that they were all very supportive. Over time, La Leche League has become more diverse and more welcoming to a bigger variety of people. And I've seen in the past even 5 years an explosion of the diversity among leaders. I think that's really important,
Yeah.
and I think it's a good direction for the organization, because we know that not everybody who breastfeeds comes from the same place.
Right.
We see people who are working and people who are single and people who are in same-sex partnerships that breastfeed in their own way, and they need care
Right.
that relates to them, just like any other community.
Right, exactly. So their resources are free.
Yes, the Leche League meetings are always free. They are led by people who've been certified as leaders based on their experience breastfeeding and their commitment to some core values of the organization. You can read lots and lots about what those values are, but they're generally positive and good things.
Of course.
Yeah.
Okay.
They're very family oriented. But those meetings are always free. It varies if they're a day or evening, or if they're women only, or if partners can come. Some are tailored towards specific topics each month, where others are a lot more just kind of whoever shows up. This is what we're going to talk about.
Okay. I want to go back to our comment about public breastfeeding.
Yeah.
And I know the Big Latch On is a big deal in terms of public breastfeeding. Do you do anything else to promote public? I know that we got door decals. I think that was from the Central Texas.
No,
breastfeeding
that's
club.
no.
Or was that
I know
from you?
exactly what you're talking about. That's a project of the Texas State Department of Health and Human Services,
Okay.
and so you see it everywhere, and we're part of that. There's some window decals that you can request. Most WIC offices have them if you want to pick some up, but there's other ways to get them. But they identify you as a breastfeeding-friendly establishment. So those are great to put in the front window or throughout a business, so that people know when they walk through the doors that they're not going to be harassed here, that the employees are familiar and supportive of breastfeeding. It doesn't require any special certification or rules. You don't have to have a breastfeeding room or meet any criteria other than you just want people to know that you support breastfeeding.
Right, right. Yeah, we put one up, but I haven't seen them out, quite honestly. Have you seen any or anywhere? And I wish that more people, more businesses would get on board with that. I know, oftentimes we'll be at a restaurant or something, and Lauren has no problems breastfeeding anywhere, anytime, any place. You're about to see a boob here today. If August gets hungry, you're gonna see boob, but which is a great thing, of course. But in fact, we went to a restaurant several months ago, and Lauren was breastfeeding August, and then my daughter-in-law was at the table. She was breastfeeding my other granddaughter, and then right
woman
behind
next to
us
us,
was a lady at the table who was breastfeeding her child. And I just looked around and thought, oh my gosh, this is awesome. In fact, I took a picture and I posted it on Crunchy Boutique, which it was several months ago. But I just thought it was a wonderful thing. But I don't really see those decals anywhere, and quite honestly, I don't often see women out breastfeeding.
Mm-hmm.
I think it takes seeing somebody else do it and being like, oh, I can do that. Like, okay, I don't need to go hide somewhere. But when everybody's hiding, you kind of feel like maybe you should too.
Yeah.
In the beginning with August, I was the one that was going to the bathroom or, some private place or dealing with like this huge cover up thing. And it takes time. And you're like, what?
It does. It takes
whatever.
practice too.
Yeah.
I always teach a lot of breastfeeding classes, and invariably somebody will ask, like, well, what about in public? Like, I'm thinking about pumping because I don't want to have to deal with that. And I encourage everybody to sit on the end of your bed and look in the mirror in your dresser and breastfeed your baby. Practice it with a button-down shirt that you open. Practice it with a tank top on that you pull your shirt up and, your tank top is still there covering your belly. Because that's, to me, that was what I was more modest about covering.
And I've heard the women say that.
But practice it. Try some different things and really notice once that baby's in place.
Yeah, because that's the thing. The fact of the matter is, when you're breastfeeding, for the most part, you cannot see anything other than, of course, that's what's happening.
You can tell that you're breastfeeding.
But you really can't see anything. So what is your problem?
But it's easy, and especially for a new parent, just started breastfeeding, just started learning, and the baby's still in that stage. It takes a few minutes of like looking around, and they're all over the place. That's intimidating to think, okay, how am I ever going to do that in public?
Yeah.
That's such a short time.
Yeah.
Once you get over that, breastfeeding in public's really not the circus that you have in your mind that it might be.
Yeah.
To me, the covers kind of make it crazier. Like I tried with a cover with my first, and she was a summer baby, and she learned really quickly to kind of reach back over her shoulder and like flap it like a cape, So here you are with this tent on. Yeah. And then it's waving
just drawing
wildly
more
in
attention.
the air. Right. So I got less attention when I just dropped the cover.
Right. I remember we went to a bowling alley when August he couldn't have been maybe 6 weeks or so.
Yeah, he was young. He was really young.
And she had to breastfeed him, and she was determined to cover him up. Not for her own sake, but for everybody else, so nobody else would feel uncomfortable or whatever. And she had this. I remember you had this big, heavy blanket, and it was just.
It was ridiculous. Yeah, it was ridiculous.
And I think that was the last time you ever covered up.
No, the last time was actually at the airport. We were flying standby, and we were stuck at the airport for about 12 hours. And so we're tired. I'm dealing with a 4-month-old and just all of that, and then trying to do the cover on top of it. And it was like, I'm not doing this.
Hit your limit.
She ditched it forever. She never, ever covered up again. It's like, no, just so funny. So your term as the chair of the Tarrant County Breastfeeding Coalition is coming to an end.
Yeah.
So what's next for you personally?
I don't think anything will change. I will stay just involved in the coalition, just involved at work. We're staying consistently busy. When you work with newborns, you just stay busy. They keep coming, right?
Yeah.
There is no drop off in that. So I really just plan to stay involved. This community needs assessment is by no means over, so I will continue with that project.
Which is very important.
Yeah.
That's really great. Just to be able to get that kind of information would be good.
Yeah.
So how can people get in contact with you if they need some help breastfeeding or with
Yeah, no,
or
absolutely.
Give all your contacts, all your social media handles, everything.
All right. So we have a great social media chair with the coalition, and so she typically does this. But Tarrant County Breastfeeding Coalition is on Facebook, and we're on Instagram. I don't think they've spread to Twitter quite yet, but I think it's in the plans.
Okay.
We're just kind of, when you work with volunteers, you do what you can do as you can do it. So Tarrant County Breastfeeding Coalition, or Tarrant BF Coalition is how you'll find it. The same with our website, tarrantbfcoalition.org. Yeah, that's how to connect with the coalition. You can email me at work. My work email is aalvarez, that's ALVAREZ 01@jpshealth.net.
Okay. Well,
Go
go ahead, because I can't see still. So
Okay. Well, like we always say, all good things must come to an end. And we are so happy that you were able to join us. This was just a really good conversation.
Yes, it was. Thank you.
And so appropriate with Black Breastfeeding Week coming up and this being National Breastfeeding Month.
Yeah.
So some really good information. And if anybody listening has any questions, feel free to comment on this video, and I'm sure Amanda will check back and answer any
Oh,
questions or what have you. So we also want you to remember Crunchy Boutique, the natural parenting store in Arlington, Texas, and online. Crunchy Boutique is your one-stop shop for cloth diapers, breastfeeding supplies, baby carriers, natural skincare, and other natural products for your entire family. Thank you to our listeners and Facebook Live viewers. Be sure to catch us each and every Monday from 1 p.m. to 3 p.m. on our Facebook page, Natural Parenting Talk with Lauren and Kima. If you'd like to continue on today's conversation, like I said, please feel free to comment on the video on Facebook and we will respond. So with that said, this show is over and we will see you next week.
Thanks again. Bye.
Bye.